Hello, Kathleen. Hi, nice to
Hi.
see you. Kathleen is here. She's 16 years old, so I know Kathleen for a while. Since she was 5, she's been coming to our clinic with her mom. So her mom is standing outside, sitting, which is nice to give us a little privacy. Kathleen is a young lady right now, so we want to make sure we have a little bit open conversation going, right?
Yeah.
Okay, so how you doing, honey?
I'm doing okay.
That's good. And how's school going?
It's going really well.
Which grade are you in right now?
I am in
10, right?
10th grade.
10 grades. Oh,
Yeah.
good.
The
Okay.
semester just started, so
Oh,
it's hard to believe I'm already in 10th
Okay,
grade.
that's great. And have you been sleeping okay?
Yes.
Okay, you're sleeping good. What about your appetite?
It's good.
Okay, any weight loss, unintentional?
No.
No, okay, because I noted on today you lost a couple pounds
Yes.
and you wanted to.
Yeah, that was on
Okay,
purpose.
great. So Kathleen is 5'7", her weight is 150 pounds. Her BMI is 23, which is normal. Her blood pressure 120/75, heart rate 77, respiration 17. Her oxygen 87%. She does not have fever for today's visit. And her last menstrual period was 1 week ago, right?
Correct.
Okay, good. So she has no known drug allergies, no past medical history. She has tonsillectomy removed when she was 5. She does not take any medications. She's updated with her vaccines. However, today we would like to give her meningococcal booster dose, so which is due at 16 per CDC recommendation. So after our assessment, we're going to proceed in a different room and administer your deltoid vaccine.
Okay.
Okay, great. So before we went quickly over questionnaire, so you have no abdominal pain, as you mentioned, no nausea, no vomiting,
Nothing.
bowel movements been okay?
Yes. Normal.
Okay, no diarrhea, no constipation.
Nope.
Great. Okay, good. So now we're gonna start with your assessment of your abdomen. Can you
Okay.
please lie down?
Sure.
And we'd like to lift your shirt up. Great, thank you. I appreciate it. Okay, very good. So we're gonna first start inspecting for color, contour, symmetry. Color is great. She has no rashes, no lesions, no scars. I guess, and her abdomen is symmetrical. Her contour is flat. Good. If you can lift one leg at a time for me. Good. Good. This one. Okay. Does it cause any pain for you?
No.
No. Okay. Great. So we're gonna proceed with auscultation for bowel sounds. We will listen for at least a minute in each quadrant. We will start with the low quadrant. All right. Great. I think you're a little hungry. Okay, I can hear bowel sounds. It's every 10 seconds, which is normal finding. Oh, great. Good. Okay, so I hear bowel sounds normal, which is normal finding. Hypoactive bowel sounds would indicate constipation or even paralytic ileus. Hyperactive gastroenteritis, which accompanied by diarrhea. Okay, so now we're gonna do so the bell. We're gonna use the bell of the stethoscope to listen for the vascular sounds. So we're gonna start from aorta. So it's 2 fingers above the umbilicus. All right, and umbilicus actually look really good too. No lesions, no rashes, skin around is intact, and no piercings. All right. So above 2. So use a bell. We listen for Brut. Okay, I don't hear any Brut. It's a normal finding. So we're gonna listen for the renal artery. Renal, 2 centimeters. So we listen for the right. Okay, and for the left. Good. And we're gonna listen for iliac artery. Okay, no Brut, which is all normal findings. All right, now we're gonna move to palpation. So we're gonna start with light palpation, just feeling for any masses and tenderness. Please let me know if it elicits any pain.
Okay.
So we start from the right low quadrant, moving clockwise with just the tip of my fingers rolling.
No pain.
Okay, great. So we're gonna move to the deep palpation. We start from the right low quadrant, and while we're here, we can assess for Murphy sign.
No pain.
Okay, no pain. That's great. Negative Murphy sign. Okay, great. No pain. So we're gonna palpate for the liver. So take inhale and exhale. Alright, okay. Feel the low edges of the liver. It's nice and smooth. I don't feel any lesions or anything like that, no masses. And we're gonna palpate for the spleen, but we wanna make sure, she's not here for Mona visit, which she's not. And also there will be no trauma to the spleen. Spleen is a highly vascular organ. We don't wanna palpate something that can rupture. Okay, take a deep breath in. Alright, good. Alright. I don't feel spleen, which is normal finding. So that means spleen is not enlarged. Okay, great. Thank you. Okay, now we're gonna percuss. We'll listen. Okay. Areas of tympani, it's normal. And we're gonna percuss for your liver. We wanna measure the size by percussion. So we will start with mid-clavicular. Third intercostal, so the upper border of the liver would be where the nipple side. So we're going to percuss down and try to assess the border, the low border of the liver. So we listen for the area of dullness, since liver is a full organ. Alright. Alright. So we can see right here, and it would be like 2 centimeters below the costal margin. We could feel the edges of the liver, which is normal. And we would percuss for the spleen also dullness. It's normal finding. Okay, great. Okay, so now we're gonna move to GU. If you can kindly sit up. Alright, great. Alright, Kathleen, now we're gonna check for your kidneys. Alright, so I'm gonna tap on your kidneys, and if it elicits any pain, let me know.
Okay.
So we find the spine, and then we're gonna do costal margin and pull the. Any pain?
No.
Okay. And as I'm aware, nobody has a history of kidney stones, right? Okay,
No.
great. All right. And you've been voiding, okay?
Yes.
Okay, no blood in your pee, no urgency.
No, not at all.
Okay, and just a private question.
Mhm.
Are you sexually active?
I am.
Okay, good. And what kind of barrier do you use?
I use condoms.
Okay, condoms is a great way for protection of STD. But any discharges,
No.
vaginal, no, any lesions,
Nothing
rashes,
like
no.
that. No.
Okay, if at any point you feel like you want to talk, if any start to bothering, or you would like to switch from condoms to maybe pills, you're always welcome at our office. You know that, right?
Yes. Thank you.
Okay, great. So everything seems fine. So we're just gonna do the ICD code for today visit would be Z00.129. So this is encounter for routine child health examination without abnormal findings, and also Z23. It's encounter for immunization. So please follow me. We're gonna administer you a meningococcal booster dose in your deltoid.
Okay.
Okay, great. Thank you.
Oh, yes.